Many people take vitamins to protect their hearts. For years, one specific vitamin was trusted to lower heart disease risk, but recent research reveals it could actually do the opposite. In this video, we'll expose which vitamin this is and why it might be more harmful than helpful for your heart. Stay with us to uncover 5 surprising reasons it could be putting your heart health at risk. Let's dive in. Back in the day, doctors saw this vitamin as a wonder drug for lowering cholesterol. It seemed like a dream come true, a simple vitamin that could protect your heart and keep your arteries clear. But here's where things get interesting. Scientists started noticing something strange. Even though the vitamin was great at lowering bad cholesterol, people taking it were still having heart problems. This vitamin is called niacin, or vitamin B3. The cholesterol disappeared, but the heart risks stayed put. This puzzling situation became known as the niacin paradox. Let's break down this paradox in simple terms. It is like when you're cleaning your house. You use a super strong cleaner that makes everything look spotless. But later you notice that while the surfaces look clean, there's still a funny smell in the air. That's kind of what was happening with niacin. It was cleaning up the cholesterol, but something else was still causing problems. Scientists started digging deeper, and they discovered that when our bodies break down niacin, they produce some not-so-friendly substances. You might be thinking, why is this common vitamin harmful to heart health? We'll take a closer look at the sneaky ways niacin might be tricking your body and putting your heart at risk, starting with number 5, 4-PY accumulation. 4-PY or 4-pyridone 3-carboxamide shows up when your body has too much niacin to handle. When your body gets too much niacin, your body converts the excess to 4-PY instead. This substance is like a toxic spill in your bloodstream. Scientists first discovered this hidden molecule while studying blood samples from people with heart problems. They were searching for clues to understand why some individuals experience heart attacks or strokes, and there it was, 4-PY. By analyzing blood samples from over 3,000 adults, researchers found a strong connection between high 4-PY levels and serious heart issues. Those with the highest 4-PY levels, about 25% of the group, faced a 1.6 to 2 times greater risk of heart attacks, strokes, or even death due to heart-related problems. But here's the really interesting part. Even when the scientists considered other things that affect heart health, like age, weight, or smoking, 4-PY still stood out as a major risk factor. High levels of 4-PY in your blood could be a warning sign, telling you that your heart might be in danger down the road. Now that we know about 4-PY, we can take steps to protect ourselves. In the coming sections, we'll explore more about how 4-PY affects your body. At number 4, it increases inflammation. Your blood vessels are like smooth highways for your blood to flow through. When inflammation strikes, it is harder for blood to move smoothly, and it can lead to all sorts of problems for your heart. Let's break down how 4-PY causes this harmful inflammation, step by step. First, 4-PY sneaks into your blood vessels. Once there, it starts messing with the cells that line your arteries. These cells are usually peaceful gatekeepers, but 4-PY tricks them into thinking they're under attack. Next, these confused cells send out distress signals. They start producing chemicals that call for backup. This brings white blood cells rushing to the scene. Normally, white blood cells are the good guys, fighting off infections. But in this case, they're showing up to a false alarm. As more and more white blood cells arrive, they start to cause damage. They release their own chemicals, making the inflammation worse. Scientists have seen this process up close in animal studies. When they gave mice extra 4-PY, they saw their blood vessels become inflamed and damaged. Over time, this constant inflammation leads to a serious condition called atherosclerosis. This is when your arteries start to get clogged up with fatty deposits. As these deposits build up, your arteries get narrower and harder. This makes it tough for blood to flow through, and it puts a lot of strain on your heart. So why was this harmful effect of 4-PY overlooked for so long? Well, that's a great question, and it leads us to our next point. Number 3. A common ingredient. Let's take a trip back to the 1940s, a time when doctors were fighting a nasty disease called pellagra. This illness was caused by not having enough niacin in people's diets. To solve this problem, they came up with a clever plan. Add niacin to everyday foods like flour, grains, and cereals. It was like giving everyone a daily vitamin boost without them even knowing it. This plan worked wonders. Pellagra became a thing of the past, and everyone thought niacin fortification was a great success. Fast forward to today, and we're facing a whole new problem: It turns out that 1 in 4 Americans might have too much niacin in their bodies. So where's all this extra niacin coming from? Well, it's hiding in plain sight. Every time you eat a slice of bread, munch on some cereal, or enjoy a bowl of pasta, you're getting a dose of niacin. It's in energy drinks, protein bars, and even some snack foods. And let's not forget about supplements. Many people take extra niacin thinking it's good for their heart, not realizing they might already be getting more than enough from their food. This discovery has sparked a big debate in the medical world. Some experts are starting to question whether we should keep adding niacin to our foods. The Cleveland Clinic-led study head, Dr. Stanley Hazen, says the main takeaway is not that we should cut out our entire intake of niacin. That's not a realistic approach. A discussion over whether a continued mandate of flour and cereal fortification with niacin in the U.S. could be warranted. He's suggesting that the food industry might need to rethink how much niacin they're putting in products like bread. It's a tricky balance. We still need some niacin, but not as much as we're getting now. As we wrap up this part of our countdown, you might be feeling a bit uneasy. After all, niacin is in so many foods we eat every day. But don't worry, knowledge is power. By understanding this issue, you're already taking a step towards better heart health. Nearing the top of our list at number 2 is hard to balance. This vitamin is tricky. Too little, and you're in trouble. Too much, and you're still in trouble. That's niacin for you. It's got doctors and scientists scratching their heads. Let's start with the basics. The National Institutes of Health says adults should get about 14 to 16 milligrams of niacin a day. Sounds simple, but most Americans are getting way more than that. Remember how we talked about niacin being added to lots of foods? It's in your bread, your cereal, and even some snacks. Plus, many people take supplements. It all adds up, and before you know it, you're way over the recommended amount. Scientists are still trying to figure out exactly where to draw the line. If you take too much niacin, your body lets you know. You might get a red, itchy flush on your skin. Some people feel sick to their stomach or get headaches. In severe cases, it can even damage your liver. You see, most people can already get all the niacin they need from a healthy, varied diet. There are lots of foods that naturally contain niacin, like chicken, tuna, and peanuts. But what about those niacin supplements sitting in your medicine cabinet? Should you toss them out? Well, that's what we're going to talk about next. Number 1, the supplement trap. Niacin supplements have been popular for years, especially among people trying to lower their cholesterol. Many folks believe these pills are a quick fix for heart health. After all, if a little niacin is good, a lot must be better, right? Well, not so fast. A typical niacin supplement contains 300 to 500 milligrams of niacin. That's above the daily recommended value. It's like eating 20 loaves of fortified bread in one go. Compare that to the niacin you get from food. A serving of chicken or tuna might give you 10 milligrams of niacin. Even a bowl of fortified cereal usually has less than 5 milligrams. Dr. Stanley Hazen says, the average person should avoid niacin supplements now that we have reason to believe that taking too much niacin can potentially lead to an increased risk of developing cardiovascular disease. But why are these high doses so dangerous? Remember 4-PY from earlier? Well, the more niacin you take, the more 4-PY your body produces. The Cleveland Clinic research team found that folks with elevated 4-PY levels had a 1.6 to 2 times higher risk of major cardiac events over 3 years. Now, you might be wondering, what should I do if I'm taking niacin supplements? Don't just stop taking them on your own, especially if they were prescribed for a specific reason. Your doctor can help you weigh the risks and benefits based on your individual health needs. But for most people, the best way to get niacin is through a varied, healthy diet. Foods like chicken, fish, nuts, and legumes are all great sources of niacin. And the bonus? These foods come with lots of other nutrients that are good for your heart. As we wrap up our countdown, let's reflect on what we've learned. The story of niacin is a powerful reminder that more isn't always better when it comes to vitamins and supplements. It shows us how complex our bodies are and how important it is to approach health with balance and care. So, what's your take on the risks associated with this vitamin? Do you think it's time to reconsider certain supplements? Share your thoughts in the comments below. We'd love to hear from you. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and hit the bell icon so you never miss our latest health tips. Lastly, if you enjoyed this video, please consider showing your support with a super thanks. Your support allows us to keep bringing you valuable content that enhances your health and wellness. Thanks for watching, and here's to making the best choices for your heart.